So, treatment of IRS. 10 years ago, I developed my own treatment strategy. It consists of 5 steps. I put it into practice, and I'm seeing some amazing results. And only for that reason, I wrote the book. So, an average person out there can understand insulin resistance syndrome and can benefit from this strategy. I'll quickly go through that. Okay, I developed my own diet, and it's not even a diet, it's lifestyle changing. Okay, that's the most important thing. And this has worked. I spend time myself with my patients, talking about their diet, talking about the principles of my diet, and I tailor my diet according to their requirements. Because some people are vegetarian, some are non-vegetarian, with all different ethnic backgrounds. Diet is definitely number one, the most important thing. So, if you want to get this diet, it's in my book, it's on my website. Here are some of these salient features I'll go through. Watch your mental habits. So eat when you are hungry. Don't eat for psychological reasons, because you are mad or angry or sad. Be aware what goes in your mouth. Keep a food diary. Very important. No more than 3 meals a day, even for all diabetics. No more than 3 meals a day. Reduce the size of your portion. Cut carbohydrates. Have more proteins. Increase vegetables, meats, and fish. Eat a lot of nuts. That's the best way to increase your HDL. And certain foods are really bad. You have to say no to them. And here they are.
You've listed everything that I like.
That's right.
I don't see chocolate up there. I don't see chocolate.
That too.
Some people like
That too.
You're going to find it all.
Okay, next one please. Okay, again, no sodas, even diet sodas, no power bars, no artificial foods. Okay. No buffets, no fast foods. And you need to get involved with your food. And it's not too late to start learning how to cook. I did. And again, when you're eating, please don't watch TV or don't be reading the magazine, okay? Mental distractions and eating, they don't mix. You end up eating a lot. Most people here, they know the benefit of exercise, right? But we still don't do it. What's the reason?
Still late.
You like the concept of exercise rather than the exercise itself.
You read about it.
Okay, so please start doing exercise today, right today. I mean, no if and but, no conceptual talking about it. Just do it. The night is. Okay, any exercise, simple walking, 30 minutes a day, wonderful. Okay, do that.
My pedometer.
Anything, do exercise, walking, swimming, wonderful exercises. For diabetics, just a word of caution, jogging or even jogging on treadmill is not good, because most diabetics, they develop peripheral neuropathy. The nerves become very susceptible to any injury, so their neuropathy can get worse, 1. 2, again, diabetics who are a little more advanced, they develop a retinopathy, and again, any jarring exercise can worsen their eye disease, so be careful. But swimming is always good, walking is always good, yoga is wonderful.
How about the elliptical?
It's fine, elliptical is fine. Stress management, extremely important, okay? And this is my own approach. I divide stress into 2, external stress and internal stress. External stress, we all know, those are stressful situations. Somebody is ill, somebody got in an accident, whatnot. Okay, next one. The other thing that is even much more sinister is internal stress that most of us have it pretty much all the time. Even if on the surface we are having successful life, we are having vacation, we are in Hawaii, you know, but our mind is busy. It's that busy mind, ever busy mind that gives that internal stress. I love this wonderful phrase. Wherever you go, there you are.
Yes.
Love it. Okay. What does this busy mind do? This busy mind will always keep you either in the past or in the future, skillfully bypassing the reality of the present moment.
Be here now.
Now, logically speaking, past is dead, it's gone. Future never arrives, right? So logically speaking, you should live in the now. But we could say that we are all illogical. Because we live in the past and we live in the future. That is what this busy mind is, very illogical. Okay, here's an example. You are on the freeway. Your busy mind is thinking, you're going to work. He's thinking about the argument you had with your wife. You can't buy the mortgage and she's buying $200 shoe like money grows on trees. And the next moment you are thinking about your next doctor appointment. Maybe he'll tell me I have cancer, then I'll probably die a miserable death in a year, nauseated all the time like Uncle Bob did from chemotherapy. Or like physically you're on the freeway, but mentally you're far away, far away. So, please remember this. Keep your mind where your body is. When lost in thoughts, ask two questions. Is it happening now at this very moment? Almost always the answer will be no. Next question, what is happening right now at this moment? Vitamins plays an extremely important role in treating insulin resistance syndrome, which unfortunately traditional medicine has not looked into. But I did. I looked at all the research which was done on vitamins, and this is what I found. And of course, there are a lot of claims too. So I looked at all these studies, and here is what I found. These vitamins do help with your insulin resistance. Vitamin D, alpha-lipoic acid, chromium picolinate, fenugreek, nopal, cinnamon, CoQ10, and magnesium. Okay, so I put all these vitamins together and I created this called Glupride Multi. Anyone interested, you can go on a website called Online Medinfo and get it. Only two medications. One is lactose, the other is metformin. Both of these, they treat insulin resistance. Both of them do not have any serious side effects in most of the patients. But any medicine does have potential side effects, and you have to watch out for that. Same case study we started with. I'm going to go through that quickly. These were his numbers. He was on insulin, Procardia, Vasotex, Zocor, a long list of medications. Next one. Okay. These were his blood pressure was still high, was on blood pressure medication. He was obese. These are his numbers. Look at his fasting blood sugar. 169, A1C 11.2, extremely high. Triglycerides 962, extremely high. Look at HDL 22. Okay, next one. Okay, of course he had insulin resistance syndrome. Next one. So, put him on my 5-step treatment approach. Gradually I stopped his insulin. Over a period of time, his diabetes got better, HDL cholesterol got better, triglycerides came down. Next one. And here's the thing, at 40 months, his cardiologist decided to do an angiogram. He called me from the OR and he told me, Sarfarz, what are you doing? I said, what? He said, Mr. So-and-so, I was expecting him to have worsening of his coronary artery disease. Actually, it got improved. That cardiologist came to see me the very next day.
Great. Are we able to book him the next day?
So guys, if you want to know more about insulin resistance syndrome,